All right, 2 wants to know is focused on your health care. What are we doing here? Well, we've got a virtual phone bank going on right now with the North Carolina Navigator Consortium. Mark Van Arnhem is with me. He is my guest for the day. So you are the director of the consortium. You've got 25 experts here on the phones ready for people to take calls.
Yes, we do, and we are ready to help however we can. Open enrollment is happening now through January 15th, so take action, get enrolled, and get covered.
All right, so this is how you get your thoughts, your feelings, your questions all out to those who can actually help you. The number's at the bottom of your screen. It's 855-733-3711. So for folks at home who are like, okay, who's the North Carolina Navigator Consortium? Help them out.
Yeah, so the North Carolina Navigator Consortium is a network of 8 community-focused nonprofits across North Carolina, led by Legal Aid of North Carolina. So we are across all 100 counties. We offer in-person assistance, virtual assistance, telephone assistance, whatever makes it easy for you to learn about your options on the health insurance marketplace and to get enrolled.
All right, and so this is a free call.
Yep.
It's not like they're going to be signed up for something and charged for something or anything like that.
That's right. No, our services are totally free. We are funded by the federal government to do this work, and we have the 2nd largest Navigator grant in the country to do this work. So we've been doing it for 10 years now, and we're really proud of the work that we do.
All right, and you guys know the ins and the outs of all of the healthcare plans that are there, and there are dozens of them on the website, which is a lot to navigate through.
Yeah. Even for me, I've been doing it for 10 years, and it sometimes confuses me. So these folks on the screen are the real experts. They help folks enroll day in and day out. They answer questions outside of open enrollment about bills and even using your health insurance, how to make a doctor's appointment and read your summary of benefits. These folks are the go-to people. And again, it's free of charge, and we want to make sure that you get the plan that's right for you, your family, and your needs.
All right, so when you call that number that's at the bottom of your screen, you're going to be connected to one of the experts one-on-one. Your questions and things of that nature, they're not going to be on TV. It is between you and that one navigator. All right, so let's talk about open enrollment period. Open enrollment has already started for ACA.
Yeah, started November 1st. And it runs through January 15th, but there's a couple deadlines to really recognize. December 15th is the deadline to get coverage by January 1st. So if you don't want any kind of lapse in coverage, say you've got marketplace coverage now, and you don't want to be auto-mapped into a plan, or you're losing employer coverage, act by December 15th to get that coverage that starts on January 1st, so you won't have a gap. If you act after December 15th, or rather December 15th through January 15th, I'm sorry, the dates are all clogged up in my head, you will get coverage starting on February 1st.
Right.
So you would have a little bit of lapse in coverage, but you're still able to enroll between December 15th and January 15th.
And if you miss the January 15th deadline, then you're kind of out of luck for that next year.
Unless you have a certain life event, having a baby, getting married,
changing a job.
Changing a job, that's one of them for sure. There's also a special enrollment period now that's going to be continuing on for the next year or so, where folks between 100 and 150% of the federal poverty level are able to access this coverage at any time during the year. So we could help those folks at any time during the year.
All right, let's talk about the family glitch.
Yes, we are thrilled that the family glitch is a thing of the past. The family glitch was a glitch in the law where if you had, say you and your spouse had 2 children and the spouse had an offer of employer-based coverage. If that offer of employer-based coverage was deemed affordable for the spouse alone, then it was deemed affordable for the whole family. And we know that oftentimes when you add one more person on your work health insurance, the price goes up astronomically. So those folks were not able to get the tax credits to help pay down the subsidies in the marketplace. So now that is gone. If the employer benefit is not affordable for you and your family can then access the marketplace.
Right, and this is like good timing for this because a lot of employers are now showing their healthcare package and asking people to enroll in their healthcare. So if you're interested in your own healthcare because they pay most of the premium, that kind of thing, but it is not affordable for your family, then the ACA marketplace is something at least for you to look at.
That's right. And we're here to help with you. If you just want to ask questions, if you want to look through your options, if you want to go all the way through the enrollment process, a lot of folks just come to us and find out their options and then go home and talk to their spouse and complete their enrollment at home. And that's A-okay. We just want to be here to help.
Right. And so tonight, when you're calling that phone bank number that's at the bottom of your screen, it's not like you have to sign up right now.
That's correct.
But you can get your questions answered.
Yep, that's what we're here for. And we can also make you an appointment to sign up tomorrow or in a week from now. We can help you get an appointment via Zoom, telephone, or even in person.
Okay. And again, this is free. This is not something that you're paying for. All right. Let's talk about the marketplace subsidies.
Yes. Very important. The Inflation Reduction Act that was just passed several months ago extended the subsidy enhancement that started with the American Rescue Plan after COVID. So that made subsidies much harder for folks. So folks anywhere between 100 and now beyond 400% of poverty level are able to get subsidies to help pay down the cost of their coverage. And that subsidy comes in the form of an advanced premium tax credit that is paid directly to your insurance company. And so let's say you are eligible for $480 worth of subsidies and you're picking a plan with a $500 a month premium, you're only going to pay $20 a month of that. And they're going to send that check, $480, directly to your insurance provider.
All right, and we're seeing on the graphic there was 9 out of 10 people.
Yep, 9 out of 10 people here in North Carolina who have enrolled are getting financial assistance to help pay for that coverage.
Okay.
4 out of 5 people are getting coverage for less than $10 a month.
And so folks are saying, okay, what do I have to know to get that kind of coverage? They just need to call and say this is, they have to be able to say what their income is so that we can see if they are qualifying for those subsidies.
And we know a lot of folks can't correctly estimate their income. They may have side jobs, they may do other things. So we're experts at getting that income correct so you can get the best possible subsidy and pay that lowest price for that quality affordable health coverage.
Okay, if you're just joining us really quick before we head to break, we have a phone bank here talking about ACA enrollment. We've got you hooked up with experts. The number is on your screen, 855-733-3711, and we'll be right back.